To ensure that we can keep all the necessary prevention measures in place, we are, as required by the Disaster Management Act, extending the national state of disaster by another month to the 15th of December 2020. The second area of concern that we need to pay attention to is the upcoming festive season in our country, during which time many South Africans travel to other parts of the country and where people tend to relax and to gather socially. These activities, if not undertaken responsibly, pose the greatest immediate threat to our management of the pandemic. We're working through the Africa Centers for Disease Control and Prevention to acquire and to fund a vaccine for the African continent. It is estimated that our continent, Africa, will need around $12 billion and 750 million doses of an effective vaccine. Earlier this week, in my capacity as chairperson of the African Union, I established the COVID-19 African Vaccine Acquisition Task Team to lead this effort. Our Minister of Health, Dr. Zweli Mkhize, will serve on this task team together with other outstanding citizens of our continent. South Africa has also been appointed as a co-chair of the global ACTA initiative that is facilitating access to innovative interventions, including vaccines, for all countries. Countries are going to have to allocate funding so that there can be access to vaccines to prevent the further spread of the virus. In recognition of our country's manufacturing capacity, one of the leading pharmaceutical companies in the world, Johnson & Johnson, has entered into a preliminary agreement with a local company, Aspen Pharmacare, to manufacture and package its candidate vaccine. Aspen has capacity to manufacture 300 million doses of the candidate vaccine at its Nelson Mandela Bay plant in Port Elizabeth. This life-saving medical product will be needed across the world, and it will be manufactured here in South Africa by South African workers. And obviously, we are bidding very hard to have an uptake of the product that will be produced here in our own country. With COVID-19, we're also shifting from relief to recovery. As the economy starts to recover, many of the measures in the relief package are steadily being wound down. We are trying within our limited resources to ensure that this is done in a gradual manner. We recognize that some industries are still not able to operate fully and that it will take some time for many jobs to return. That is why we extended the special COVID-19 grant for a further 3 months until January 2021. This will provide much needed income to around 6 million people who are unemployed and who do not receive any other form of government assistance. Following extensive discussions with our social partners, the UIF will extend the COVID-19 UIF TERS benefits scheme by another month to the 15th of October 2020. As we transition to a new phase in our response, the only way forward is a rapid and sustained economic recovery. We are therefore working to enable all parts of our economy to return to full operation as quickly and as safely as possible. We are amending the Alert Level 1 regulations to restore normal trading hours, for instance, for the sale of alcohol at retail outlets. We are also opening up international travel to all countries subject to the necessary health protocols and the presentation of a negative COVID-19 certificate.